the elderly and those with underlying health conditions. That's why I am extending my Safer at Home order through May 6th for the vulnerable populations. From the beginning, I've been committed to making decisions based on scientific data and the advice of our public health sectors here in the state of Oklahoma. While we need to keep up our guard, we are looking and we are working on a plan to safely open up the state. Like we've done all along, we will make our decisions based on data here in Oklahoma and the advice of our public health professionals. Earlier this morning, I talked to the mayors from across the state of Oklahoma. I personally had a conversation with Mayor Holt from Oklahoma City, Mayor Bynum from Tulsa. I think it's important to issue statewide guidance, set up guidelines on how we can safely reopen the state. We suspended elective surgeries to do a couple things. Number one, to protect hospital beds in case of a surge and we needed more hospital beds. Number two, to protect PPE for the healthcare workers who are treating COVID patients. Our hospitals have been great partners with the state, but many of them are struggling with low numbers. Hospitals have had to furlough workers in some cases, and I've heard of nurses, single moms, who have lost their jobs because the demand is so low. Because we feel good about our hospital numbers and our PPE, I am announcing today that elective surgeries can resume in 9 days on April 24th. Our Governor Solutions Task Force is still continuing to be proactive and preparing for anything COVID might throw our way. We will continue to monitor our hospitalizations and our PPE from around the state day and night. We're also working with our health department to come up with guidelines to reopen restaurants and non-essential businesses in a safe manner. For the essential businesses who have stayed open, you're doing a really good job. Thank you for innovating and finding safe ways to continue to serve Oklahomans and protect your workers and your customers. If your business has employees who can work from home, we need them to continue working from home when practical, and we'll phase them back into the office over time. We've been training our healthcare community on our comprehensive surge plan. It's called Project Echo this week. We had 850 doctors and healthcare providers on a webinar just this morning. Part of that plan also includes innovative ways to use telemedicine so every Oklahoman has access to the level of care that they need, no matter where they live across our state. I've also asked Dr. Casey Schrum, who's Secretary of Science and Innovation, to give us an update on the Project Echo. Dr. Schrum?
Thank you, Governor. I want to provide more detail around how we utilize telehealth during our anticipated surge. Telehealth is an innovative way to expand the existing capabilities of our healthcare systems all across the state. This will allow Oklahomans who do not need a higher level of care but could utilize specialty services to remain in their communities and closer to their loved ones. We will deploy 54 telemedicine carts to strategic rural locations across the state. As we look to the future in anticipation of reopening Oklahoma, we'll make decisions based on data and on availability of resources that will be needed. We will begin expanding our surveillance and tracking capabilities. We ask that Oklahomans be patient and continue to be diligent in your social distancing, practice good hand hygiene, and wear masks when you're in public places as recommended by the CDC.
Thank you, Dr. Schrum, for that wonderful update. So, Oklahomans, I just want to reiterate how important it is that we continue to practice our social distancing. We've got to wash our hands, stay at home if you can, stay at home if you're feeling sick. One of the things I love about Oklahomans is our hardworking DNA that's part of our fabric. And I know that Oklahomans are hurting right now. We have, I think it's 211 folks that have applied for unemployment, and I just want you to know that we are going to get through this. Light is at the end of the tunnel. You have been doing a fantastic job of social distancing, and we have flattened the curve to your credit. So just a little bit longer, I want everybody to stay home, stay safe, and stay strong. God bless you. God bless the great state of Oklahoma.
Governor, I'm sorry.
I was just going to ask what you would say to those that were driving around the Capitol today, frustrated because they're ready to go back to work. What would you say to them that they're feeling that way?
Yes, so I know that Oklahomans are frustrated, ready to get life back to normal. That's, our plan is to do it safely. My orders, the executive orders are through April 30th. We extended the Safer at Home for the vulnerable population through May 6th. But we're working on plans to open up. We'll have more things in the future. We're going to do it safely. I've met with the Restaurant Association. Our health department is working on a safe way that we can start opening those restaurants back up. Our non-essential businesses, we started with elective surgeries in 9 days to get those back up. We're going to monitor the data, and I'll continue to let Oklahomans know, but we have to continue the social distancing to make sure we don't have a new surge. But we have to keep on this path through April 30th.
Governor, this weekend you talked a little bit about antibody testing, and you believe that our state, one of the leading states in that testing. We know there's some Norman firefighters that are doing some testing as well. Can you tell us what this means for some of our frontline workers, or what it could potentially mean for them?
Sure. Let me have Dr. Schrum come up, and she's the expert on the antibody testing.
Yes, so we have been working very closely with lab in Norman to develop antibody testing right here in the state. What that tells a person who takes that test is whether or not you have been exposed to the virus and developed an antibody or had an immune response to it. It does not confer immunity, but it does decrease the risk and understanding that you have been exposed and that you have had an immune response. I think that we can use that in surveillance, and that informs us about what's going on in the population. Also, our frontline workers knowing whether they've been exposed at this point and developed some form of immune response is important.
Could it mean that those frontline workers who may have that immunity could be the ones who are dealing with these COVID patients, if that's the case?
Well, we don't know how long, if you develop immunity, how long your immunity would last. So this is very early. I think it's good for us to know who has been exposed, who's been asymptomatic but had the virus. But it does not designate people who are completely safe from virus at this point in time. So we are going to be rolling out more of what we're doing and using that as a way to understand how the virus is moving in various populations. And you'll hear more about that soon.
Governor, just your reaction to the letter from the House Democrats wanting you to call grocery store workers and people in that area first responders.
We meet with all the legislatures quite often. Actually, right after, I think 4 o'clock today, I have another call with all legislators giving them an update. So we listen to all the advice from them. We've done a lot of things for our first responders around the state, and we're looking at all that information. Our business community, we've helped, the Commerce Department has really set up programs to help our business community, our folks that have been hurt, our workers, and we passed an executive order to allow our first responders to be paid for up to 2 weeks if they do contact COVID-19. So we're looking at all those things to help those first responders. We have specifically addressed the grocery store workers.
Governor, I think there was a potential breakfast this morning between you and the Pro Tem of the Senate and the Speaker of the House. Obviously, you probably can't talk a lot about how that went, but there was a lawsuit filed yesterday regarding the equalization matter. Can you give us an update? Was it a good breakfast? Did you guys share some laughs? Did you find any common ground? What can you say?
It's always a great breakfast when I can have breakfast with the leadership of the House, the Senate. So those are my friends, and I think of all the House and Senate members are my friends. It's disappointing that we're over here focused on saving lives, building up the hospital plans, working on getting the economy back going, working on all those Oklahomans that have lost their job, and so haven't focused much on the budget at this point. We've really been diving into the COVID stuff, and it's that's what my focus has been today and really for the last 30 days.
Any thoughts on the lawsuit?
It's just disappointing.
Thank you.
Dylan Richards, KOCO.
Thanks, Governor. I just had a question about your Safer at Home order. Is the only thing you're extending the Safer at Home for people over 65 and immunocompromised, or does that include business closures as well as gatherings of 10 or more? And if not, why not?
So every executive order is expiring on April 30th. The only one that we've extended at this point is the Safer at Home through May 6th for the most vulnerable population, the immune compromised. The others, we're going to be looking at those over the next 2 weeks find out how we can safely reopen. We're also looking at the CDC guidelines. President Trump will be issuing some more guidance. I'm on the phone constantly with governors around our region on what they're doing, how they're going to safely reopen their states back up. But at this point, the only one that we've extended was the Safer at Home for the vulnerable population through May 6th. And the others that we're taking those day by day, I actually moved back the elective surgeries from April 30th. That's going to be moved back to April 24th.
Steele, Oklahoma.
Governor, what metrics are you using when you look at when to reopen the economy? Is it, you mentioned hospitalization, is that the main metric you're going to be using? Also, what do you mean by reopening the economy?
So the main metric is hospitalizations, ICUs. Those are the things that we're watching, that we're flatlining, that we're looking at that curve, making sure that we don't have a spike back up. So yes, those are the main ones we're looking at. And when we say opening back up the economy, we're talking about non-essential businesses that have closed down. So you're talking about restaurants, barber shops, eventually museums, eventually all those social gathering businesses. So the first one was the elective surgeries. The plans are being worked on. How do we safely do that? We've got the health department working on those. Do we need to test all of the workers at a restaurant? Do they mask up? Do we spread the tables apart 6 feet apart? All those things we're working on to slowly step back in to more of a normal business life.
Butler, KTUL.
Hi, Governor. So right now there's, I'm sure a lot of people driving around the Capitol, happy to see that you're talking about reopening the economy. On the flip side, you've got a fair number of people out there that might say this is premature and we're just, kind of tempting fate away, kind of waiting to see if this will spike back up again. What would be your response to those people?
Well, we're doing this with the guidance of the experts at our health department. We're also being data-driven. From the very beginning, I said we're going to be basing decisions in Oklahoma based on what's happening in Oklahoma, the data that we're seeing, not what's happening in a different state or a different city or what the news might be saying. And over the last 17 days, our hospitalization has been continuing on a slow decline, which is a great thing. But I also want Oklahomans to know we've got to continue social distancing. We've got to continue the policies that we have in place through April 30th. We're going to monitor this data day and night to make sure that nothing spikes and no trends go the different direction, because that would be the last thing we would want, is to slowly start opening things back up post April 30th. And we see some kind of spike. So it's still important that we continue everything. We're also we can't really get out in front of the CDC or what the White House is recommending. So we're going to continue to wait and get some guidance from them as well over the next couple weeks.
Governor, can I just ask you about hospitalizations? You said, quote, over the last 17 days, our hospitalizations have been continuing on a slow decline, which is a great thing. Are you referring to people leaving the hospital? Because the cumulative numbers continue to go up. If we just go back to April 10th, we've got an increase of 18, an increase of 17, an increase of 4, an increase of 31, and then most recently today, that would be, I'm bad at math, 22 new folks coming in. Are there people leaving the hospital, and that's what you're referring to? Because it looks like we're still getting a couple dozen to a couple dozen people a day entering the hospital with COVID.
Well, we look at the net number in the hospital, both ICU and the net number of the hospitalizations across the state. So, of course, you've got people coming in and you've got people exiting the hospital. That overall number in the hospitals is what we track on a daily basis from all across the state. That number peaked at 560 on March 30th, and it's slowly gone down. I'll be getting a briefing tonight of exactly where it is today. It was, I think, 420 or so yesterday across the state. That's the numbers that we're tracking.
Those aren't on the website, to my knowledge. If we get those emailed, that would help provide that accurately.
Perfect. We'll get that to you.
Thank you.
Barbara, Tulsa World.
Governor, do you have any plans to call a meeting of the Board of Equalization?
Barbara, we're working on that. That's part of the budget discussions that we're working on with the House and the Senate. It was my intent to fully fund April, May, and June, which we have a budget shortfall for the 2020 budget, and we've got plenty of time. We fully funded April, and we've got all the way till May to call a Board of Equalization meeting and work out an agreement with the House and the Senate. And it's been my objective all along to make sure we protect core services over the long haul. And the unfortunate thing is Oklahomans are hurting right now, and we have budget shortfall for the last 3 months of this year, but that doesn't end next year either or the year after that. Oil is down, Oklahomans are struggling, and we've got to be very thoughtful of how we roll this out and we use our savings over the next 3 years. And my job as governor is to continue to let Oklahomans know that, and also work with the legislature to come up with a great budget that protects core services over the next 3 years.
This one might be more for Dr. Schrum, but on the total death toll from COVID-19, there was some added that were from the 3rd to the 13th. Just curious to why the delay of those, or does that just confirm that they did die from COVID-19?
Actually, Secretary Lothridge can answer that one.
Thank you. You have seen a slight difference in how we've reported the deaths. That's evolving, so our commitment is to absolute transparency on this. And so one tweak we made to the data is to try to get these in the right periods. If you imagine, for instance, a death that might happen in a rural area, we don't have an immediate notification that deceased person might have died, for instance, from COVID. That simply takes a little bit of time. And so we've been aggregating those as we go. And so what we've tried to do is true up according to the actual period. So again, it's hard to get it within a 24-hour period. That's not how we receive the data, but we've tried to put those in correct periods. And so that's adjustment we've made, and we'll keep that cadence going forward.
Secretary, maybe you can answer this as well. There's been some discussion, and Governor, obviously, if you would like to, but there's been some discussion and question about what the medical examiner's office might want to do in terms of post-mortem testing. Can you give us the latest that you can talk to about that?
Sure. I'll actually defer to Dr. Schrum as to the protocol on that. I believe she's worked on that. Thank you.
Thank you. Thank you, Doctor.
Yes, we have had conversations with the medical examiner. They can do post-mortem testing, and those specimens can be collected and frozen until another time. We are trying to strike a balance between having testing available to people who are hospitalized and working to allocate testing materials and swabs for the medical examiner to be able to do that.
Is there a recommendation on, I spoke with a woman whose story was up there, and now she thinks that her son did die from something else. But at the time, she was really unsure. She didn't know whether she should go get tested. She didn't know whether people or something contacted you. So do you have a recommendation for anybody who experiences a loss of life in the family?
Well, depending upon the circumstances, whether someone has underlying conditions that could account for their death versus a suspicious death, or someone that we anticipate we need to find out the COVID status, it all depends on those circumstances, whether or not someone would receive an autopsy at the time. And so I think that is something to be communicated with, if someone loses a loved one, and decisions to be made on a individual basis based on the actual condition of the patient and their underlying conditions.
Thank you.
Quentin Chandler, State Impact of Oklahoma.
Yes, thank you, Governor. Are you planning to push for prison releases right now? And also, do your emergency powers give you more options in terms of prison releases?
Any prison release would just go through the normal process through the Pardon and Parole Board. November 1st, we had the commutation, and some of those are still trickling through the Pardon and Parole Board. So we have regular meetings with them. Our legal team reviews all those. They put those on my desk. But there's no difference or change because of COVID-19 in the release, the commutation, the pardons of anybody in Oklahoma. Public safety is number one, and there's been no change because of COVID-19.
Kim Miller.
Okay, I'm unmuted. Apologies. Thank you, Governor. Some in the medical field, health officials are indicating concerns of a second wave of this virus starting this fall and winter. What sort of preparations, thinking obviously months and months ahead here, how concerned are you of a second wave of this virus later this year, and what sort of preparations have you considered?
Well, that's always, the second wave is always a possibility. You look at other outbreaks that have happened over the history, and sometimes they come back stronger in the fall. And so that's something that we're obviously concerned about, and we're going to monitor. We're going to keep these plans in place. The hospital, right now, my focus is continuing to see that curve flatten, continuing to remind Oklahomans what we can do to social distance, wash our hands, staying safe. So we'll monitor that, and that's a long ways away. And as you notice from the curve, that we were planning on in March, it obviously was flattened, and that's a great thing. And so we will continue to monitor that as we get through the summer and into the fall. Thank you.